Chapter 22 is on pregnancy and breastfeeding. So, in this chapter, we're actually going to be looking at some drugs that are contraindicated to women that are pregnant. And these are the drugs that we're most interested in because these are dental drugs, local anesthetic, epinephrine that's found in local anesthetic, pain relieving medications. These are all medications that we will see in the dental office. So, it's important to know what pregnant women can take and what they cannot take. What we really got to do is do a risk to benefit ratio. Is there a benefit to taking that? Does the benefit outweigh the risk, or is it too risky to take that medication? Will it really affect the baby will it harm the baby? Will it produce congenital abnormalities? So we're going to look at medications and we're going to look at the risks that some medications present. You may have heard of this word right over here that is called teratogenic, and it comes from the word, so terato comes from monster, and gen means producing, and basically what it really comes from is it means producing a monster. So this word actually means producing a monster. And what it's really trying to say is that if we were to take a drug that is teratogenic, then we could be producing a baby which is not well, which is not, which may have significant abnormalities in their facial features, in their mental, um, you know, health. There could be many things that could go wrong. So at the end, we really got to ask ourselves, is it worth taking that drug when we are pregnant? Now, women, when they're pregnant, they go through trimesters, 3 trimesters. And in the first trimester, we could give them dental cleaning, but remember that we do not give x-rays, so it's only looking at through visual examinations. We'll take x-rays after they deliver the baby. The second trimester, this is the best trimester to do dental work in. In the first trimester, I should also say that people feel very nauseated. They feel very nauseous, and that's why we try to avoid dental treatment in the first. We say come during the second when you're more comfortable, because majority of the women are more comfortable in the second trimester, and they're able to tolerate sitting in the chair or lying in the chair for an extended period of time. So second trimester is the best trimester. Third trimester, again, we say we try not to, because we try to encourage them to come in the second trimester, because in the third trimester what happens is that this is the time when they're closest to delivery, and so the woman may find it very difficult to lie for any length of time. So we have to avoid giving any drugs like local anesthetic at that time unless absolutely needed. So there are several drugs that have teratogenic effects, or there are several drugs that we say absolutely no to taking during pregnancy because they could really affect the baby in a harmful way. So before 2015, the FDA came up with categories, pregnancy categories like A, B, C, D, X, N, and they would say that if it was an X, if it was a medication that was listed under category X, then that is a strong no. It's definitely contraindicated for pregnant women. And if the drug is in category A, then that is safe to take. Now, however, what they've done is they've changed it a little. So now we do not have these categories anymore. Rather, what they have is that they just have labeled it in a certain way. So if you go to this, drug labeling section, if you go to section 8.1, it'll list all the drugs that pregnant women are allowed to take. It also talks about all the drugs that's safe during labor and delivery. In this section over here, it talks about all the drugs that are safe to take when a woman is nursing. And lastly, it looks at this section here where it says all the drugs that are safe to take for females and males who may be trying to have babies. So, for example, there are drugs, or let's look at nitrous oxide. Nitrous oxide, which we will actually be looking at later on today, is a type of drug that even if males take, it can affect their partners. It can affect their partner's ability to conceive. It can also cause abortion and birth defects. So this is even for males that are surrounded by nitrous oxide. Breastfeeding. There are many benefits to breastfeeding. And that's why we always encourage women to breastfeed if possible. However, there are some drugs that we say do not take when nursing, and we will be looking at these drugs later on. But these are the drugs we say please don't take when nursing. So, in dentistry, we see local anesthetic agents a lot. The safest one that we can administer to our clients is lidocaine. So, lidocaine is very safe to take when pregnant. But pivocaine, we say please don't take it because it's shown to show birth defects in rats and rabbits. And mepivacaine, we say it's not been tested, so we say don't take it. But lidocaine, as well as these two other local anesthetic agents, are safe. Lidocaine is the safest one. Epinephrine, so we always give epinephrine in our local anesthetic agent because it allows the area to be frozen for a longer period of time. So when we give epinephrine, we say give a small dose. Give the dose that we give to someone who has a heart condition. Okay, so 0.04 is what we usually say. Analgesic, so this is a pain reliever, and when we want to recommend a pain relieving medication to our client, we want to be careful because there are specific pain relieving medications that are good for them, which we will go over. But what the key thing is if they're coming in pain and they have maybe an abscess or something, the first thing you want to do is drain it, right? Clean that area and drain it all off. Because maybe you can avoid giving them a pain medication by just draining, by just incising, cutting, and draining off that area. Maybe you could avoid giving them the pain reliever that way. So try to use other methods of therapy before you ask them to take drugs. So one of the pain relieving medication is aspirin. And we say don't give them or don't let them take aspirin because there are lots of complications such as stillbirths. It can complicate delivery. So aspirin we say don't take during pregnancy. NSAIDs, same thing with NSAIDs. We say, it can make delivery more difficult. It can, cause some issues. The only NSAIDs that you can have when nursing, so when nursing, not when pregnant, but when nursing, is ibuprofen. Okay, so ibuprofen or Advil is the only medication to take if you are nursing, but otherwise we say don't take anything when you're pregnant. Acetaminophen, this is the one that is considered to be safe in pregnancy. Okay, so when you are pregnant, you can take Tylenol because there have been, actually I shouldn't say this, there's actually been no studies conducted in humans. However, they did studies in animals and they've done other studies too where they have noted that there is no side effect when you take Tylenol. So no, it will not harm the baby. Analgesics. So analgesics are pain relieving, another type of pain relieving medication. And the one we're going to look at is opioids. And opioids is the one that's addicting, right? So codeine is a common opioid that's prescribed during dentistry. And we want to be careful with prescribing codeine when someone is pregnant because there are lots of abnormalities that can happen. A point to note is that if the mother is addicted to codeine, then when the infant is born, and is obviously at that time the infant is not going to be given codeine, the baby will experience withdrawal symptoms after birth. So we really want to avoid being addicted to any opioids because it can have a harmful effect to the infant while pregnant and also after delivery or after birth.